Hello, guys. Welcome to Med Corner, a captivating podcast dedicated to exploring the vast and ever-evolving world of medicine and health. I'm Dr. Habila Augsburg, and I'm here with my very good colleague.
Am I a very good colleague? Hello, guys. I'm Dr. Yahweh, and today we'll be doing something a little different. Went to Google, and then we asked Google, what have people been asking you about medicine and health? And we got a list of 10, and we're deciding to answer the 5 most Googled health questions. The source is from 2023, and we hope that you do learn a lot. So, to our first question. But what's our first question?
All right. Our first question here is how to lower cholesterol.
Okay, so I'm not surprised that a lot of people are looking for ways to lower cholesterol levels. But first, I want people to know that cholesterol in itself is not a bad thing. In fact, you may not be able to function properly without cholesterol levels. But there's this idea out there that cholesterol is a bad thing. It's what makes you fat. It does a lot of harm in excess quantities. But in itself, it's not a bad cholesterol. As a matter of fact, there are good cholesterols and there are bad cholesterols. Now, very high levels of the bad cholesterols is what causes problems. And then the good levels of the good cholesterol is fine. Now, imagine that you have good cholesterol and then your good cholesterol is very low. It's still a problem, you know. Yeah, so in this regard, to be referring specifically to the bad cholesterols, how to lower the bad cholesterols. Yeah. Now, diet is the most important thing, or one of the most important aspects, one of the most important things that we need to consider in lowering these cholesterols. We should lower the saturated fats and then the trans fats. Saturated fats are mostly found in red meats, red meats. Then red meats are meats found in most animals that use 4 legs. So, your cow, your goat, sheep, and all that. So those are red meat specifically. So you need to reduce the quantities of red meat consumed to lower this cholesterol. And apart from that, the trans fats are also mostly found in margarines, in pastries like cakes, shawarma. Do you like shawarma? I know a lot of people. A lot of people love shawarma and then love meat pies. They love pastry. So I'm not saying you should stop eating it completely, but I mean lower. In moderation. In moderation, lower that, and then that will help with lowering cholesterol levels. Apart from the diets, exercising, limiting beverages like alcohol. Smoking, very, very important. So doing all this in moderation, or not even doing them at all, like smoking, alcohol, not taking them at all, would help lowering blood cholesterols, the bad blood cholesterols. So I think I was able to answer that.
Yeah.
Okay, so...
Even though there are some people that genetics plays a very important role, especially for people with something called the familial hypercholesterolemia. But we are not going to dive so much into that. We are talking about the modifiable factors, things that you could change and things you could do to lower the cholesterol level.
Exactly.
So we'll be going to the next question. You guys should stick to the last because the last is going to shock you. So it says, how long does food poisoning last?
Okay. Again, I'm not surprised that people go on to check this because we may go out to party, you eat different food, and then maybe in the night or in the early hours of the morning, you're already vomiting, you're passing low stool, you're purging, and you're having serious abdominal cramps, and you're trying to look for a solution. And then you go on Google, how long is this thing going to last? So typically, food poisoning should last within 1 to 2 days. However, sometimes it may last up to 13 days, depending on for severe cases, depending on the organisms. So from food poisoning, we begin to have things like gastroenteritis and even enteric fever. Yeah, so for mild cases, within 1 to 2 days, and then for severe cases, it can even go up to 13 days. But what was important here is that once you're beginning to experience those symptoms, you're losing a lot of fluids. So just try as much to stay hydrated, drink a lot of water, and if it persists for more than a few hours to 1 day, please go and see your doctor because it can become very, very fatal. Have
So
you? Yes.
some people think food poisoning has to do with going to Babalao and then someone putting something from the Babalao in the food. Because
Yes,
whenever people hear food poisoning, that's the scenario that comes to mind.
exactly. And I don't blame them because growing
And
up,
that's also food
yes,
poisoning, I
yes.
guess.
I don't know if that's food poisoning, but growing up, once you hear poison, you're already thinking of
Yeah.
the concoction prepared by the native doctor to kill
Exactly.
somebody and all that. I don't know if that's food poisoning, but the food poisoning we're talking about here is the ones from germs, yes, and
All
and
right.
yes, microorganisms.
Thank you, Dr. Yahweh.
So,
So the next question says, what causes what?
okay, what?
Yeah.
Okay, so what is caused by a group of 150 viruses. This group of viruses is called human papilloma virus. There are about 150 serotypes of them. Yes, and then they're usually contracted via skin to skin. Yes, so once someone has like a contact with someone who has the what, you can contact the what. So there are different types of what: skin what, genital what, oral what. I'm not sure. I think are there oral what? No.
Yeah, oral warts.
Okay. Yes. Well, genital what and skin what are the most common. Yes, and then I think the person or the people who go on Google to ask these questions because of the genital what. That's one of the common presentations of this, and then it's also a sexually transmitted kind of problem, sexually transmitted disease in quotes. So they are caused by human papilloma virus, and they can be attended to. You just once you have those kind of symptoms, just go and see your doctor. Yeah. So that's about that.
So the next question, I was kind of wondering, they would be asking about high blood pressure, but the question says, what causes low blood pressure?
Okay, I think we'll just talk about the two. The
Okay.
two. There's the blood pressure. How do I explain this? Now you could imagine this hose you once used to water flowers connected to a tap and then used to water flowers. Now there's a pressure in which the water moves in those hoses. The same way your blood vessel your blood vessels, the
Acts like the
arteries, the veins is acting as the hose, and then the pressure in which the blood is moving in the pressure in which the blood is moving in the vessels is the blood pressure. So there should be a normal range in which below it is the low blood pressure, above it is the high blood pressure. There are different guidelines. There's the American Heart Society, and then so many other guidelines. But generally, once I don't know if I should begin to go into the systolic, and then there's the diastolic. You've checked your blood pressure before. There's a value on top, and then there's one below. So once you're having a value greater than 129, it's already not. It's already getting above the normal.
range.
Yes, and then for the lower one, once you're having a value greater than 99, it's already going above that. And then once you have a value below 90, and then a value below 60 for the lower one, it's already going lower. So
No one is even going into shock.
yes. So the question is,
What causes
low
low
blood
blood pressure?
pressure?
Yeah.
Okay. They are physiologic and then pathologic. I shouldn't use too much medical
When you
terms
say
here.
physiologic,
Yeah, it
you
just
mean like
means
the normal,
yes,
normal causes?
yes, there are some causes that are not really disease conditions, but
Like pregnancy,
exactly pregnancy,
athletics.
prolonged bed rest. Sometimes you're sleeping for a very long time. Your blood pressure can go low, but not so low, and then other causes may be there are medications that you may be taking that's reducing your blood pressure. You may not know. Some mental health problems can also cause low blood pressure, like depression can also cause low blood pressures. And then
Yes, dehydration too. Someone is severely
dehydration, exactly. And then some losing blood. You're bleeding from somewhere could cause low blood pressures. So as a matter of, so as a rule of thumb, you have the SFIG, that's the blood pressure machine at home, and if you check it and you notice that this is low or this is getting, and then it has been consistent, persistent for, you've had that value so many times, please see your doctor. It might not be normal for you, so see your doctor to do something about it. And then it could also get very high, anything more than you're having 130, 140, over 90 to 100, going above that, and it's consistent. Please go and also see your doctor.
In addition to that, I should mention that one of the causes of blood pressure could be the SFIG itself. Or sometimes people leave the batteries in their SFIG for a long time, and then it could give like wrong values. So I mean, before you start to panic, make sure you change the batteries of your SFIG to make sure that the values you are getting are the actual values of your blood pressure. So on to the last question: how to stop snoring? I bet it's the wife that asked this.
Why did you say that?
Because I feel men snore more.
Okay, I don't know if there's a statistics that back that up, but I don't know women. Women snore too. You didn't say anything. You don't agree with that. Women snore too. So is it how to stop snoring, or why do people snore?
How to stop snoring?
Okay, how to stop snoring. Okay, again, there may be physiological causes and pathological causes of snoring. Yeah. So maybe after someone has tried the different modifications and then they're still not snoring, I would advise first, I'm saying this first, that you should go and see your doctor, because not all snoring is normal, or there's some snoring actually, they actually are pointing to a more, something serious. Because there are obstructive sleep apneas, there are sleep disorders that cause the snoring. And then there could also be some brain injuries that cause the snoring. Apart from that, some airway problems, so airway obstructions, some tumors, those could also cause snoring. I'm not trying to scare you, but I just needed to say this first. But having said that, most causes of snoring are physiologic. So some things that people can do to stop it is at first, if the person is on a big side, you have to try to shed some weight. Then you lose some weight, that could help. That on its own could help.
There could be some fats at the back of the throat that narrows like the airway, causing the snoring. So I guess it makes sense that if you should shut down some of those fats, it should resolve.
Yes, automatically it can help a lot. Apart from trying to lose weight, sleep positions can also make people snore. Because by the time you lie down, your tongue can go back a bit, and then it obstructs the airway, and then snoring, the air, you're trying to force in air when you're sleeping, and then bring out air, and then mix that noise. So your sleep position can also be a reason for that. So according to some research done in Mayo Clinic, said most people that sleep on their backs are prone to snoring. But there's a controversy here, because the orthopedic surgeons will tell you it's better to sleep on your back. Then maybe the ENTs are saying, okay, by the time you sleep on your back, it could cause snoring. So how should people sleep?
I feel you should. What is the best comfortable position for you? I mean, if you sleep on your back and you don't snore, I guess you can continue sleeping on your back. You don't have to, like, say, compulsorily sleep on your side.
Very, very true. Anyways, for those who sleep on their backs and then snore, you can try sleeping on your sides, especially on the left lateral positions, and that could help. It's also safe. It's also okay to sleep on your sides. What's discouraged is sleeping on your belly, because that could change your spine or put a lot of strain on your spine. You could wake up with back pains. So sleep positions also help. There's something called nasal strips, and then some jaw devices that have been found to also help improve snoring. It inserts it, helps with lifting the jaw up when you are sleeping, and then that also helps open the airways, so it's easier for air to go in and then to come out. I don't know if I'm missing anything, but weight loss, sleep positions, these oral devices could also help. Very important. Alcoholics snore a lot.
And
so
other sedatives
yes, alcoholics. So reduce alcohol, cut down alcohol. Gone are days where we tell people take alcohol in moderation.
Yeah.
Because what is moderation for you? And someone was saying my moderation is 1 crate. So
Yeah.
so we advise just cut down alcohol completely. So we advise cut down on alcohol, smoking. All this can make people to continue to snore persistently.
Yeah,
So
I think in addition to stress plays a very big role in causing snoring. So maintaining your stress levels could help.
thank you very much,
Yeah.
Dr. Bog, for that. So just as I said first, these are like physiologic reasons. There are disease conditions that could also cause snoring. So if this has been persistent, you've tried a lot of things and it's not working, please again go and see your doctor. Go and see your doctor. There are solutions that could be advised, and there are things that could be done for people generally.
All right. Thank you very much, Dr. Yahweh. And this is the end of the 5 questions. I mean, if you have more questions you'd like to ask us, drop your questions
Don't
in the
go to
comment
Google
section.
again because
I mean,
anyway, so these questions we got were from 2023. We got a list of 10 questions and they were selected 5. So drop more questions for us, and then maybe in subsequent episode we can pick them and then attend to. Thank you very much, guys.
thank you guys.
Bye.